Hi, I'm glad you reached out. I'm Dr. Zamir Páez, a board-certified plastic surgeon licensed to operate in Colombia and also in Dubai. My mission is to support your journey toward becoming your best self, always keeping in mind your safety and well-being. My commitment to you is high-level plastic surgery focused on your essence. Today, I want to talk to you about gynecomastia correction, a procedure for men who experience an abnormal enlargement on the chest due to excess of glandular tissue, fat, or the combination of those two. This condition can cause physical discomfort and insecurity, especially when you are striving for a flat masculine chest. So during this surgery, I carefully remove the overdeveloped mammary gland, as well as the fat deposits that affect the definition of the pectoral area. To do this surgery, I make small incisions that will be hidden in your body. Nobody will see that, because for us, like men, it's important to take our shirts off and to go to the beach and that nobody realized that we did this surgery. So through very small incisions, I can manage this problem. I can also use technology to have a better result. I could use Vaser, the ultrasound, and also the microair to remove the fat and to emulsify the fat. Through an open approach, the scar will be hidden inside the areola. I can remove that breast tissue, that breast gland that normally is in the inferior pole of the breast. During surgery, I carefully remove the overdeveloped mammary gland as well as the fatty deposits that affect the definition of the pectoral area. To do this surgery, I only use small incisions and I can place cannulas inside to remove that fat. However, it's not the traditional cannulas. I will be using Vaser to emulsify the fat to also help me to extract more breast tissue, because we as men also have breast tissue. I will be using the microair, and I also could use a technology that will improve the retraction process after the removal of this tissue. Some patients will require an additional incision inside the areola, but the good point about this is that it will be camouflage, it will be hidden, and nobody will notice that you did this surgery. So through that approach in the areola, I can remove the breast tissue. So actually I can do a mixture of two techniques, an open approach and also a closed approach, to achieve a better result. This is plastic surgery for men, designed to reinforce your masculine identity. As always, my approach is personalized. I analyze each case with attention to detail, considering your anatomy, medical history, and aesthetic goals to deliver results that are not only safe, but also balanced and long-lasting. Are you ready to take the next step toward your best self? It will be a pleasure for me to be with you through this journey. I'm Dr. Zamir Páez, and I hope we can meet us soon in a personal or virtual consultation.